Stemrum has developed new medicines named regeneration-inducing medicines. The regeneration-inducing medicines enable the regeneration of damaged or diseased tissue not through cell or organ transplantation, but simply through the administration of a drug. We have stem cells in our body. The stem cells generate new cells in a variety of organs and ensure the maintenance and repair of our body. Certain stem cells can be isolated, expanded and manufactured outside of our body. The stem cells have been used as therapeutic medicine, which is called stem cell therapy or regenerative medicine, to treat devastating disorders such as heart failure and neurodegenerative diseases, which cannot be treated with conventional chemical medicines. To implement the regenerative medicine, it is ideal to isolate the stem cells from the patient's own body. However, it is often impossible to expand the patient's stem cells sufficiently enough to obtain the therapeutic effect. Instead, the stem cells can be isolated from healthy donors. To achieve that, immunocompatible donors must be screened and identified, and a sufficient amount of stem cells must be isolated from the multiple donors and expanded without losing the therapeutic potential and quality. It is also not technically and economically easy. Stemrum has developed new medicines named regeneration-inducing medicines, which can circumvent the obstacles of the regenerative medicine. The technology is based on Professor Tamai's discoveries. Professor Tamai is a medical doctor in Osaka University. He discovered that highly therapeutic stem cells exist in our bodies. In our body, regeneration-inducing medicine triggers the growth and circulation of these stem cells, which accumulate at the damaged tissue. Therefore, the damaged tissue is repaired. Once the intravascularly administered medicine reaches the bone, it activates and grows the highly therapeutic stem cells in the bone marrow. The stem cells enter the blood vessels out of the bone marrow and circulate all over the body through the bloodstream. The stem cells are attracted to the signals emitted from the damaged tissue. Then, they repair the damaged tissue. Regeneration-inducing medicine can significantly strengthen our natural healing mechanism. It does not need donors and complicated process of cellular expansion and quality control unlike cell therapy. The regeneration-inducing medicine has the potential to cure many incurable diseases through the accumulation of highly therapeutic stem cells at the diseased tissue. Our first regeneration-inducing medicine, named Redassemtide, was effective for more than 10 diseases in animal studies. Now, clinical trials are going on for 5 diseases: cardiomyopathy, acute ischemic stroke, chronic liver disease, knee osteoarthritis, and epidermolysis bullosa. Epidermolysis bullosa is an incurable congenital skin disease, which develops blisters, ulcers and erosions on the entire body throughout the life. These pictures are a lower limb of a patient who participated in the clinical trial. Left is the photo before the treatment, and right is the one after the treatment with Redassemtide. The red ulcer hadn't closed for years, but it was closed and covered by skin just by 4 weeks of the treatment with Redassemtide. And then, there was no recurrence of blister and ulcer at least for 25 weeks after the completion of the Redassemtide treatment. Regeneration-inducing medicines tackle incurable diseases by utilizing highly therapeutic stem cells in our body and massively enhance our natural tissue repair mechanisms. Stemrum is developing multiple regeneration-inducing medicines by understanding and utilizing our natural repairing potential and mechanisms. The regeneration-inducing medicines are safe, simple and straightforward, and will open up a new era of medicine.